Hello, and welcome to our presentation, Through a Dog's Eyes, Understanding and Managing Glaucoma in Canines. Dogs rely on their vision to explore and connect with the world. So what happens when pressure inside the eye leads to silent changes in their experience? Well, this is what happens in the case of glaucoma. So what exactly is glaucoma? Well, it is a progressive disease that is characterized by an imbalance in the production and drainage of the fluid within the eye. This causes a buildup of the fluid known as aqueous humor and increases the pressure within the eye. This pressure can destroy the optic disc, where the optic nerve enters the eye, as well as the retina, resulting in vision loss. Glaucoma occurs in about 1.7% of dogs in North America and is characterized by two types of onset, open angle and closed angle. Open angle glaucoma has a gradual and painless onset, causing a period of vision loss over a long time. Closed angle glaucoma happens when there is a very sudden increase in the pressure due to fluid buildup, which causes pain, redness, and a very rapid loss in vision. The physiological consequences of glaucoma range from moderate to severe. It is incredibly important to catch this disease quickly, as prolonged pressure can cause enlargement of the eye, as well as issues with the lens and the membrane of the cornea. The most common clinical signs are squinting, corneal edema, which looks like a white haze in the eye, excessive tears, loss of vision, dilated pupils, so bigger pupils, pain, and eye bulging. If you notice any of these signs in a dog, they should be examined immediately by a veterinarian so that a treatment plan can begin. Most treatment options are determined by the kind of glaucoma that's present, either primary or secondary. Primary glaucoma is generally linked to heredity, but secondary glaucoma results in trauma, such as cancers, inflammation, cataracts, and lens luxations. The consequences of this disease are permanent loss of vision, eye enlargement, pain, and in severe cases, enucleation, which is the surgical removal of the eyeball. There are some gaps in research regarding canine glaucoma. Certain genetic markers for canine glaucoma have been researched, but they are very breed-specific. This means they are only effective in screening for certain breeds. More research on genetic markers for glaucoma would increase the likelihood of early detection, which enables preventative measures. The current early screening methods are less than ideal in regard to the early detection and marking progression. Therefore, improving on research on different early detection methods would likely improve patient outcomes. Finally, there is no current cure for this disease, which in the majority of cases results in blindness regardless of the treatment. More research is indicated to improve long-term treatment protocols and potentially prevent any vision loss.
Hi, my name is Jacqueline Kennedy, and I will now discuss genetic risk factors of canine glaucoma. There is a strong genetic component to canine glaucoma. Canine primary glaucoma consists of two types. Primary open-angle glaucoma, POAG, is less common in dogs. Primary angle closure glaucoma, PACG, is most common and strongly influenced by genetics. PLD is a condition present at birth, passed down through family lineage, and is significantly associated with PACG. The primary genetic risk factor for canine glaucoma is breed predisposition. Some dog breeds have a genetic predisposition for primary angle closed glaucoma, such as the Cocker Spaniel and Basset Hound. The frequency of breed predisposed glaucoma in both eyes in purebred dogs is the highest in any animal species, except humans. Dogs between the ages of 5 and 10 years old were found to have an increased risk of developing primary glaucoma. Females were found to be at twice the risk of males for developing primary glaucoma. Genetic mutation in the Adams TS10 and Adams TS17 genes can lead to POAG in beagles, chow chows. Though dogs with primary glaucoma experience rapid vision loss with acute inocular pressure elevation, breeds such as the Norwegian Elkhound, Samoyed, Chinese Shar-Pei, and chow chow are reported to maintain vision for the extended periods of time, even with severely elevated IOPs. While primary glaucoma is not caused by external environmental factors, secondary glaucoma is. Environmental factors can include toxins, chemical exposures, living conditions, trauma, or other pre-existing ocular conditions. Adverse effects of medications can include ocular surface inflammation and conditions like keratitis, conjunctivitis, and blepharitis. Environmental factors can cause excessive pupil dilation and inflammation, leading to secondary glaucoma. Thank you.
So we've seen how breed differences in canine glaucoma show the connection between anatomy and physiology, with certain breeds being prone to structural abnormalities in the iridocorneal angle, like pectinate ligament dysplasia. These anatomical traits reduce aqueous outflow and increase glaucoma risk, and studies show dogs with these defects experience more rapid disease progression. Understanding these variations improves our knowledge of pressure regulation in the eye. If aqueous humor drainage is limited by anatomy, intraocular pressure, or intraocular pressure rises, chronic elevation of IOP compresses the lamina cribrosa, blocking axonal transport in retinal ganglion cells and initiating apoptosis. Ultimately, these processes lead to peripheral vision loss caused by impaired neural communication and the death of retinal ganglion cells. Taken together, breed anatomy, physiology of pressure regulation, and genetic predisposition interact with environmental and aging factors to shape disease risk. Detecting these changes early with imaging and developing breed-specific reference data could guide therapies, improving outcomes of canine patients and advancing our understanding of glaucoma across species.
Eye morphology and intraocular pressure. A normal eye keeps its pressure in balance by draining fluid through the trabecular meshwork, which works like a natural drain. In dogs with glaucoma, that balance is disrupted and the pressure inside the eye starts to rise. Over time, this elevated pressure damages the optic nerve, and once that damage happens, vision loss is permanent. And that's why glaucoma is such a serious condition and why early detection is very important. At the molecular level, the drainage system depends on a balance between enzymes that break down collagen and proteins that slow the breakdown. In glaucoma, that balance shifts. And so the enzyme doesn't work properly, and there's an increase in TIMP2, which blocks collagen breakdown. This means the normal flexibility of the outflow pathway is lost, and the pressure will start to rise within the eye. Those molecular changes add up over time, and because the collagen isn't broken down in the way that it should be, the tissues in the trabecular meshwork stiffen. Stiffer tissues can't drain fluid efficiently, so pressure continues to climb, and that higher intraocular pressure is what pushes the disease forward, creating more and more damage inside the eye. That pressure doesn't just stop at the drainage system, it actually directly impacts the retinal ganglion cells, which are the cells that carry visual signals from the eye to the brain. On top of the pressure, the blood flow is often compromised, which means that the cells are likely not getting enough oxygen and nutrients that they need. Together, the stress and the lack of blood supply causes retinal ganglion cells to die. Since these cells can't regenerate, their loss leads to permanent vision decline. Researchers have studied glaucoma in dogs to better understand how these processes work. Humphrey and colleagues looked at how the molecular changes affect collagen breakdown and tissue stiffening, showing why drainage resistance continues to increase. Karomi and colleagues focused on the retinal ganglion cells, explaining how pressure and blood flow problems damage them. When we put these studies together, we see that glaucoma is not just one problem, but a combination of mechanical, vascular, and molecular factors all working against the eye.
So the conclusion of our overall presentation is the glaucoma in dogs is a physiological disease that causes disruption to the aqueous humor drainage, causing rise in intraocular pressure. Due to the increase in pressure, this leads to an optic nerve damage at both mechanical and cellular levels. The physiology of canine glaucoma integrates in multiple different types of systems, including aqueous humor dynamics, extracellular matrix remodeling, inflammatory signaling, and optic nerve degeneration. These mechanisms together show that glaucoma is not a simple issue of elevated pressure, but a complex multifactorial disruption of ocular physiology. Just some future recommendations. By specifically using breed genetics studies, this will help build physiological models of aqueous humor flow and encourage intervention. It is important to understand the physiological basis of glaucoma in dogs as we gain insight into improving animal quality of life and welfare, and deepen our knowledge of the functionality of the eye across species.